Hello, I'm Joanna Goldthorpe from the Manchester Centre for Health Psychology at the University of Manchester, and welcome to my presentation about our development of a behaviour change intervention that supports dental practitioners' conversations with parents of children to improve their oral health. Some members of our team had already carried out work that had improved GP consultations around behaviour change in line with the Making Every Contact Counts framework. We wondered if there were similar opportunities for behaviour change conversations within dental consultations. Our survey of 32 dental practitioners plus some qualitative interviews found that yes, dentists do routinely deal with the consequences of unhealthy behaviours. These tend to be consuming alcohol, smoking, poor diet, lack of toothbrushing, and also not attending regular dental visits for their checkups. And these tend to be associated with oral cancers, periodontal disease, which is gum disease, dental caries, tooth decay, and one of the big issues facing us in the UK at the moment is that dental extractions is actually the leading cause of children having to go to hospital for a general anaesthetic. Dentists did think that routine dental care does offer scope for prevention in these areas. We used the COM-B framework to analyse our findings. The COM-B framework states that in order for a given behaviour to be successful, people need to have the capability, opportunity and motivation to complete that behaviour. Dental practitioners told us that they did feel that they needed training in behaviour change and that training actually needs to increase dentists' capability to use behaviour change techniques. We need to help create opportunities for behaviour change discussion and to also support dentists to be motivated to actually initiate these behaviour change conversations within routine practice. Plus this issue around We were fortunate enough to get some funding from NIHR through their Research for Patient Benefit programme to actually take these findings forward and develop some training for the dental practitioners based on our findings. This is also going to be tested in a feasibility study, which is the Polar Bear study. So we'll recruit 10 dental practices from Greater Manchester, practitioners including dentists, nurses and hygienists. Working in half of these practices will receive the online training and the others will form a control group. We're also going to recruit 10 children per practice, aged 0 to 5 years, who are at risk of tooth decay. These children usually tend to live in the more socio-economically deprived areas, and 50 of these children will be treated by practitioners who've been trained, and 50 will be treated by practitioners who form the control group who won't have been trained. The mixed methods feasibility study will compare outcomes for intervention practices with control practices, and we're also going to carry out some qualitative interviews with patients and practitioners around acceptability of the training and the subsequent consultation, and also looking at the feasibility issues within this. Based on our previous work and some co-design focus groups, we've actually carried out some preliminary work around developing the patient-facing materials and the online training. We identified key behaviours around toothbrushing and reducing sugar intake, and we've identified some behaviour change techniques that are appropriate for this cohort. This picture here to the left gives you a snapshot of the patient-facing materials that we've developed. This is just one page of a leaflet, and you can see here where we've added some behaviour change techniques. So on the toothbrushing page, we've got some social norms around lots of parents have told us that keeping a toothbrushing routine is important. So we've tried to make that easily acceptable. And we're going to develop some implementation intentions based on the data that the parents have given us. And implementation intentions are if-then plans, so that you identify the barrier to toothbrushing, which is the if, and then a solution, which is the then part of the plan. Some of these same BCTs are going to be incorporated into the online training for the dental practitioners. If you'd like to find out more, please get in touch. You've got our Twitter handle here for the study and for me personally, and my email address. Thank you for listening.